Welcome back, everybody. Greg Rock here from BA Institute, and lucky enough to have Simona Loven with us today. And Simona's current role, she's the Director of Operations and Strategic Initiatives at Leidos, a healthcare organization. And Simona's been sharing some of her experiences in first getting exposed to business architecture and the value that she's seen applying it to other organizations and how folks can get started and get some education. So now, Simona, if we can switch gears for a second, I was wondering if you could give our members an example of an organization you worked with where the application of the business architecture practice, made a difference for them.
So a few years ago, Greg, I worked as a business architecture consultant for a health insurance provider. Now, the insurance business, and health insurance is no different, is driven by rules. If you're in this insurance plan, then you have access to these benefits. You pay this much in premium, this is your copay, this is the maximum limit of what we, the insurer, pays. And under certain circumstances, you may also have these other benefits. If you're a woman, then you may have maternity-related benefits. And we may cover such and such a procedure, but only with pre-approval. And if your doctor is in our network, then we cover more, otherwise we cover less. So anyone who's read his or her insurance plan brochure in detail, which is never a fun read, but you know that there are lots of rules and also lots of exceptions to the rule. So now when you go to see a doctor for an exam or a medical procedure, that doctor then submits an insurance claim to your healthcare insurer. And that claim has to come in following a certain process, has to be ingested, and then has to be verified before it's paid. Now, it used to be that claims were mailed in, were submitted on paper, and were verified manually by human claims processors. Now, to this day, interestingly enough, some claims are still mailed in, but the majority are submitted electronically and they're parsed electronically. And the systems that ingest them electronically, they were developed in stages, in fits and spurts over a long period of time. And the result of that is that I would say most insurers these days, they've inherited a patchwork of systems. Some of them are still mainframe based, they developed in Cobol, others are very new, and each one of them covers a few steps of the overall claims processing workflow. Now, when the first systems were developed 40 years ago, 50 years ago, 30 years ago, the rules governing the health insurance business were more simple, not as involved and circuitous as they are today. And the software developers that created them, they hard-coded the rules, meaning they programmed them directly into the code. Now, these rules have changed. And as a result, alterations, a sequence of alterations have been made to the original code, and in many cases without proper documentation. So in addition to having this patchwork of systems, insurers also have legacy systems where the code is tenuously maintained because none of the original coders are still around.
Right.
Now, in these types of situations, you pretty much have no choice but to bring in business architects to document the business. And in many cases, this is done by sitting down with the veterans in the organization, the people who've been around the longest, who know how the business is done, and interviewing them and essentially extracting this institutional knowledge out of their minds and documenting it in different types of models. And these models have to be detailed because the system reengineering that's necessary to accomplish the digital transformation for the organization, it starts with these models. You don't have other documentation. It starts with the models and with the business rules. So in essence, what you're doing is you rebuild the data and the system architecture of the organization from the ground up starting from the business layer.
Mhm.
And this is what we did at this particular organization that I was mentioning, where the decision was to acquire COTS package, Pegasystems package, built for health insurers, and to configure the package to align it to the process models and the business rules for this organization. It was a successful endeavor.
Yeah, that's fantastic. Well, you were making me think back to in the early days when we had first launched the training curriculum from the Institute. We had a set of courses called business rules, and that morphed into business decision management. And today, in its latest form, it's part of our digital transformation curriculum, and it's now called decision automation. And we do a lot of work with James Taylor, who's a well-known author and subject matter in that space. But the business rules needs are still there. Earlier this year, we just conducted training with a couple insurance companies, and you're right, they're still trying to get the business logic out of the code, out of the old systems.
Right.
So they have much more agility and flexibility on handling things that are going to be coming down the pike, including mergers and acquisitions, which cause quite a bit of havoc. So thank you for that advice, Simona. Appreciate you coming down and share your expertise with the rest of our members.
Thank you, Greg.